Oh, there we go. Good morning. Welcome in. Wednesday, the 27th of May. I'm off today and tomorrow, but busy both days. Let me flip this mirrored image here. There we go. Has a new feature there. Okay. Wow. Lots to talk about. Woke up this morning. TikTok went off the chains for me. Like 200 more followers. We were less than 100 away from 40,000. All because of that respiratory therapy Mayo Clinic posts that I did. Those posts on Instagram and on TikTok took off. So we have splaining to do today. So we'll clarify a few things. We'll talk a little bit more about it and my thoughts on that, as well as some things that I learned last night. And an interesting interaction that I had with a physician, very positive interaction, and it's going to lean into what I teach my students. And we'll talk about that more as more people roll in. And we should be simulcasting across all the other major platforms. I get you pulled up here on the big screen. I need to get another screen so I can monitor what's going on the other platforms. Had a really big crowd yesterday morning. I think a lot of people have been having bigger live audiences than normal, and it makes me wonder um what's going on with TikTok. Like if they're doing something, manipulating things, to try and encourage more people. I don't know. Agu, welcome in. I have my coffee mug heater so my coffee doesn't get cold. Oh, yesterday was kind of a long 2 days. Monday was a holiday, but we were busier than we were yesterday. Usually the day after a holiday is crazy busy. We were busy yesterday, but Monday was crazy busy. How difficult is it working in the intensive care unit? It can be very challenging. I started my career in an ICU and I learned a lot. It's very stressful, especially when you have a vented patient, multiple pressors, and walking that fine line between the here and the hereafter. Penny Green 308, good morning. Welcome in and thank you for the follow. Brandon Lamb is a college student traveling to conferences with other students, and the Airbnb literally has rats. Uh, Leave a negative review. That would be my advice. Let's see if any of the regular crowd are in here this morning. Did you get straight into the ER? No, I started my career in the ICU, a medical surgical ICU. Spent a year there before I ended up going to the ER. Is it ever scary working with violent patients? Yes, it can be. I don't really think about it. You always kind of keep it in the back of your mind. You understand that that's a risk until something happens, right? So I've been assaulted. Um, I've been hit. I've been kicked in the throat. Good morning, Amanda Donnell's in. Welcome in, Amanda. Good morning. How's that summer nursing school going for you? Kicking your butt? Let's see. Is ER different from trauma or no? It depends. Some ERs aren't trauma designated. Doesn't mean they don't get trauma. It just means that they're not likely going to go there if there's a level 1 trauma center nearby. So, for example, the first hospital I started at was a level 3 trauma center. So we can take pretty much anything that comes in via ambulance, but most likely we're not going to be able to keep them. So if they need neurosurgery, neurotrauma, cardiothoracic surgery, we didn't have those specialties. So we could stabilize that patient and then fly them out or transfer them to a level 1 trauma center. Amanda says it's soul crushing right now. Yes, nursing school can be soul crushing. Agreed. Tech over 718. Why nurses eat their young? That's a good question. I don't understand it. I break that habit. I'm trying to break that cycle. I love new grads. I love teaching students. I'm trying to give them a positive experience because I had negative experiences and I know how demoralizing that can be. So I try to make it a good experience for my students. Let's see. I hate canine. Oh no, you hate canine. What did canine do? But thank you for the rose. I appreciate that. Gina Vanessa Garcia, thanks for the follow. This might be the live. We get over 40,000, folks. It was 39,100 when I woke up this morning. Good morning, Christy Wendy. Welcome in. They took I hate canine. They took my splints off last week and I'm still in a lot of pain. You should go see your doctor about that. Let them know that you're still in pain. Mickey, pain in and around chest, no cause by anything hard. It could be so. It could be something called costochondritis. It'd just be some of the muscles between the ribs can be sore. If it is all around your chest, certainly that could be it. But if it continues, it sounds like they've done everything. They've done the EKG. They've done lab work. Um, so yeah, if you've ever had COVID, that I had COVID and I've had it 3 times. I had the original COVID and it was like I still have a feeling like somebody put like a 5-10 pound weight on my chest all the time for like the last 6 years. And I've had every test you can imagine. I'm fine. It's just I don't know what it is. They don't know what it is. If potassium is around 2.5, that's really low. What would be the possible EKG reading? At 2.5, you're going to see some T wave abnormalities for sure. Let's see who. Good morning, Elmira. Welcome in. I feel like I missed something. A lot of folks in the room. Not gonna be able to get to all the comments. I'm gonna do my best to get to everything. And if I miss somebody popping in here, don't forget to let me know. All right. I'm just checking on the other platforms, make sure I'm not missing anything over there. I actually did have some comments yesterday and I did not see those. So I'm going to do a better job of checking over there. Let's see. Your opinion on the health unit coordinator, the Hucks. Yes. So we had Hucks when I was at the University of Virginia. They were instrumental. They handled everything, transport, you name it. So yes, very, very valuable resources to have. Whatever you need, they can get it for you. Any advice for someone who will start an advanced BSN program in the fall? Ooh, um, go with God. I don't know. Good luck. It is a grind. It's a lot of work in a very short period of time. Kristen, I have a swollen lymph node every time I eat. It's sore. Yes. No. If it's been going on, if it's something that just came on all of a sudden, um, you know, it. I would say start an urgent care. One, you'll probably get seen faster, and two, if for some reason it's something they can't handle, they will send you to the ER or refer you to a specialist. Okay, so Lulu has a joke. I'm holding my spine right now. How do I put it back? All right. Let me know what it is. It's been happening. Christy Mann says it's been happening for months. My throat feels like it's closing in. You definitely need to see. It depends on your insurance. If you have insurance, if your insurance requires a referral, you need to go to your primary care and then try to get a referral to an ENT. If you can just straight up, I can go straight to an ENT. I don't need to get a referral. My insurance allows me to do that. I would go straight to an ear, nose, and throat doctor. Because there's a lot of tests they can do. They can do a visual inspection. They can do maybe a swallow study, something like that. CTs. There's all kinds of things they can talk to you about doing. Again, so we got looks like 130 folks in here. Lots of questions coming fast and furious. If I don't get to yours, I am not ignoring you. I can only read so much. I'm like Joey from Friends. I read really slow. That's an old reference. Not everybody's going to get that. Mole the nurse. Good morning, hermano. I lost my voice 3 days ago. How long should I wait before I worry? If it's painless, um, you know, I'd give it a couple more days, but if it's not getting better, that sounds like just pharyngitis where you lose your voice. I'm kind of losing my voice right now. I was charge nurse yesterday and I did not a lot of yelling. I just did a lot of talking and I am not a talker. Oh, Bobby from Boston's in here. Good morning, Bobby. It's still raining here. You can have it. I'm tired of it. We need it. Don't get me wrong. We desperately need the rain, but oh my gosh, it's a lot of rain. but it's the perfect rain. It's not the, downpours that are going to oversaturate and just wash everything away. It's been slow and steady with occasional downpours. So the ground is soaking it in and it's good because I planted 12 trees um, 2 years ago and I'm not irrigating them this year. So, yes, I need the rain so I don't have to put the irrigation drips back in. Good morning, Michelle K. Welcome in. How are you doing, friend? Says the man with the internet podcast. I did this for years. I was a television news anchor and reporter. I had a radio show. And I like talking here. I don't like talking when there's people like in front of my face. It's a big difference. It really is a big difference when there's nobody, like all there is just people like texting and writing stuff in there. In large groups, not my thing. El Massey's in the house. Good morning. Welcome in. Damn straight. Lois got a nursing test today on foundations. That's what I teach. Well, I do clinical instructing for foundations. So good luck on your test today. Wish you all the best. Did I go to college for 2 or 4 years? I want to be an ERNP. Like you want to be an emergency room nurse practitioner? So I have 2 degrees. My first degree is in communications, class of 97. My second degree is nursing, BSN program, 4 years, and that is from, like a 4-year university. ER Tech, good morning, Marquita. Welcome in. Ashley Trombley. If people have PNES, why do people end up getting oxygen when they start having a seizure? Probably because there's concern over airway and lack of oxygen. The brain needs that. I would assume that's probably what their thinking is. I don't know. Can you give like a more specific example? I mean, as an EMT, I would put a pulse ox on them and see what their oxygen level is. If it's 100%, then I probably wouldn't do anything. Or if it's like over 94, I'm not going to add oxygen to that. How often do you deal with death and does it scare you? No, I deal with death every day. It's part of the job. We have a very, our population of patients is older and unfortunately it happens pretty regularly. Um, a lot of it's just end of life, like normal, you know, age related things. And so it doesn't really bother me anymore. Now, when I worked level 1 trauma and you would see all ages from pediatrics to people my age to people my kids' age, that was a little harder to deal with, but again, it's just something you've learned to manage over the years. My volume seems lower than normal. I don't know. I restarted everything today. Everything's plugged in the way it's supposed to. I can talk louder. Let's see. Was helping new grad and they gave the worst patients to her. 2 had to be intubated. I feel so bad. That's not normal. If you have a new grad nurse, they should not be getting 2 intubated patients. Ideally, if you get a fresh intubated patient, that's a 1-to-1 until that patient's stabilized. Oh, my other microphone is here. It's just it blends in with my shirt. It's right here. See? It's right there. The Megan Marshall, welcome in. Good morning. Yeah, I don't know. Yeah, that sounds pretty dangerous. A new nurse grad with 2 ventilated patients, that's not ideal. No. What did we notice? What did we notice? The volume? Do nurses ever think the doctor is actually wrong about a diagnosis? Sure. Yes. Why do people like this is the second day in a row somebody's asking me if I don't like telemetry. No, I don't have a problem with telemetry. They're eyes on when I can't, and they see things that I don't. So when they call me, and they don't call that often, they only call when there's an abnormality. I don't have a problem with that. I actually really appreciate I learned from a telemetry tech when I was a nursing student how to actually do that. How to measure your QRS, your PR interval, your QT with calipers, like old-fashioned calipers, which What's a code blue? In our hospital, code blue is a cardiac arrest. That's what a code blue is. Ooh, what is that? Ooh, a flash goal. TikTok wants me to do a flash goal. Sure. I'll mash buttons. There we go. 40 heart me's. That's what it is. Go for it. You want to throw out a daily heart me? There you go. So, C Steck, thoughts on the Mayo Clinic pulling RTs? We're going to get to this because I did a post on this a day or two ago, and it got a lot of traction. I didn't expect it to get a lot of traction. Michelle, thanks to the Daily Harmy, but it did. And so the comments are very interesting. Like there are hundreds upon hundreds of comments, and it is really interesting to read some of them. Now, there are a lot that pointed out that, these are 3 smaller rural hospitals. I did not make that clear. It is not the Rochester main hospital for Mayo Clinic. They obviously are going to still have 24/7. My argument to that, and I did a post last night when I got home where I talked about, yes, this is at 3 small rural. These do not have ICUs, which Mary Pat is one of my followers. She's actually in here right now. She made the comment, that's even scarier because your ICU nurses would probably be better equipped to manage your vents than, say, a med surg nurse or even an ER nurse. Like when I was an ICU nurse, I managed a vent more than I did as an ER nurse. So my argument to this is if your facility has a need for a respiratory therapist from 7 a.m. to 7 p.m., you should have respiratory therapy coverage. If you're admitting patients to that hospital and you have an ER, you should have respiratory therapy from 7P to 7A. That's my feeling on that. The other thing, and I did a post on this yesterday, I went down a rabbit hole and I looked at the people who are running the Mayo Clinic. The Mayo Clinic has 42 executives. There's way more than that, but 42 executives at the Mayo Clinic, according to Yahoo Finance, are making more than $1 million a year. And from 2003 to 2004 being the most recently available information about salaries for them, the average increase was 24% of their pay. Let's take somebody, now the CEO is making close to 5 million and he got a pretty big bump. And he is resigned. His term ends at the end of this year and there's going to be a new one in. But let's say he makes almost 5 million. Let's say, let's just take 2 million. Let's say somebody's making 2 million and they got a 24% increase. 24% of 2 million is going to be $480,000. How many RTs can you pay per year with that? And then take that across the other 41 executives. And how much money could we put towards having 24/7 coverage? Now, the articles that I read did not specify why this was happening. I assume it's going to be cost cutting. Maybe it's because they can't find respiratory therapy. But I also looked on the Mayo Clinic website. There are over 1,200 listings for respiratory therapists at other Mayo clinics. So I don't think that's the issue. But I think it's not a good look when you have 42 executives who are millionaires and getting pay raises every year, and you are cutting essential staff. And that is a hill I'm willing to die on. So, and that's all publicly available information. They're not trying to hide it. It's out there. And I think that's a negative. That is a negative publicity thing right there. So anyway, that is my feeling. Bobby, thank you for the Daily Heart Me. I appreciate that. Pickle Rick, good morning. Welcome in. Can doctors give Fent, even if the medical proxy says no without talking to you first? So I'm assuming like if you have a medical POA and if that person is legally responsible for making medical decisions, no, a physician cannot give a medication against that person's wishes. They're speaking for the patient. That would be like the patient saying, no, I don't want that. To force a patient to get that would be very bad. That could be deemed assault and the doctor could have their license suspended pending further investigation. Wanda's whimsical. Are ERs able to handle bariatric patients? Yes and no. So, for example, I worked at a smaller rural hospital. We had one bariatric bed. So if that bed was in use, we would have a hard time taking the bariatric patient, depending on how much they weigh. The other challenge is CT scans have a weight limit. I think ours is 350 pounds. So anything over 350, and it's not just weight, it's also girth. So if you have a 6'8", 350 pound, that probably would fit into the CT scanner. If you have somebody who's 5 feet tall and 350 pounds, that might be a little more, the girth might be a little bit different. So yes and no, it depends on the ER. Likely, the likelihood that your ER can handle a bariatric patient would probably depend on how big of a hospital they are. So your level one trauma centers in big cities most certainly are going to be able to handle bariatric patients. Your smaller rural hospitals, probably a higher likelihood they can't. Are lymph nodes, so we all have lymph nodes. I assume you're talking about swollen lymph nodes? Swollen lymph nodes, it's usually just the body's way of handling an infection. However, anything that is concerning to you and you are having issues with, you should go see a doctor and let them evaluate. And that's what they do. They're way better at it. Tina Sky, my dad didn't give me a POA, but he did list me as the person to make decisions. Is that the same? It depends on your state. Every state kind of has different laws regarding medical power of attorney. So, um, and if he's unable to make decisions, I still think that's a conversation they might need to have with more people at the hospital. So I maybe request a patient advocate. Hospitals usually are going to employ a patient advocate and maybe even an ethics consult. That is a thing. You can request an ethics consult. Thanks for the follow. I appreciate that. Layla, I have two cysts on my ovaries and one is 5 centimeters. There was one. Am I going to need surgery? That's a question that you need to have with your doctors. I'm an emergency room nurse. I don't work in the OR. I don't work in OB. So those are not questions that I am equipped to answer. And that's why I recommend that you talk to your doctor. Whoever ordered the ultrasound or the scan to identify those, that's who you need to talk to. What's the lowest O2 you've seen on a Oh, this is Darian's question. What's the lowest oxygen level or O2 you've seen on a alert and talking patient? I saw my new low this week is 14%. No, that's way lower than mine. The lowest I've seen on a completely alert and oriented color looks good was about 65%, and that was the happy hypoxic of COVID. And that was the one where I got COVID from, the original COVID. Let's see. How do rotating hours work in the ER? What do you mean by rotating hours? I don't know what you mean by that. We work 12-hour shifts, and the ER does most ERs will do mid shifts. So I work mid shift. I'm at 10 to 10. So we have day shift 7 to 7. We have a 9 to 9, a 10 to 10, 11 to 11. Now, some hospitals I've worked at, we've had 1-to-1s and even 3 to 3. I started 3 to 3, went to 1-to-1, and just kind of worked my way in up the ladder until I got to day shift. Rion Mac. I am in a subacute, not long-term care, one suction machine, no crash cart, 1 to 17. Thoughts? That's a little scary. No crash cart? I mean, I don't know what the rules are regarding that kind of facility, a subacute. I would say having a crash cart. I've seen long-term care facilities that have crash carts. I feel like that's essential. I guess it depends on your state regulations. What's the highest SAT you've seen in someone with a saddle? The highest SAT you've seen with someone with a saddle P without oxygen or with? Pickle Rick, Gary, thank you for speaking out about the Mayo Clinic RT issue. It's been making my blood boil. Right. I'm with you, man. Like, look, respiratory therapists are in a I mean, just I cannot understate how important they are or overstate. Like, these people are so important. We would be lost without them. Can I manage event? Sure, in the short term, as long as the patient's compliant and everything goes the way it's supposed to. But when things go sideways, man, that's not my area of expertise. I didn't spend 2 years in school learning how to manage event. I did a year in flight nursing um, academy learning how to manage vents. And most of it was all theoretical and on sim labs. So yeah, in a real world situation, yeah, that's not my wheelhouse. That is what we have respiratory therapists for. So anyway, I got in trouble. Gifting suspended and live. This has happened a lot more too. Will appeal. It's all good. Let's see. Yes. Literally said nothing other than badmouth millionaires. Talk to us about vaping, please. It's bad. You shouldn't do it. It's terrible for you. What happens if you go to the ED and you're having a mental health episode? You will be evaluated by both the medical doctor or PA or MP, and then you will also be evaluated by a mental health professional, whether it's a psychiatrist or a resident working in the psychiatric unit. Jessica got my tonsils removed due to back-to-back strep. Recently had my first strep after getting them removed. That's interesting. I have read that can happen. It is, I think, pretty rare from what I remember. And that's interesting that it was back to back because there's something called the 753 or 357. So basically, 7 infections in 1 year, 5 over 2, or 3 per year for like 3 years, something like that. Oh, did I miss Holly? Holly's in here. And Ames just checked in, reporting for duty. Good morning, Ames. Missed you the last couple days. Can shingles cause pain? Yes, shingles are excruciatingly painful for some people. And in fact, I am due I keep saying it. I just always forget to go. I need to go. Maybe I'll do it today. I'll be over there. I'll ask my doctor if he can just do it for me while I'm there. I have an appointment today. Let's see. We got Ames in the house. I got to redo all this stuff here. Heather says it's the worst pain I've ever had. Yeah. I've never had it. I don't want it. So that's why I'm over 50. I'm like a year and a half overdue. Farm D, thinking about going for nurse practitioner, just tired of school. Yeah, I get you. All right, got Mr. Clean in the house. Where'd you go, man? There it is. Back to work for you, man. Rion Mac is in Canada, new facility, and have had codes. Most patients are young and full codes, but no cart. That's terrifying. Florida Air Medic, good morning. Welcome in. How are the skies down in Florida? You guys flying today or are you off? Yep, starting back today. Oh, so you're off Monday and Tuesday. Very cool. So, Ames, I want to get your thoughts on this. So, I did a post. It was like basically um, from the live stream yesterday, I think. Audio change, no music. Gosh darn it. No music and echo. What the heck, man? All right, we're going to pop it off. All right, let me know if you hear it now. Is that better? No music. I don't know what's going on. It's weird. Yeah, just glitched out. Is it better now? Can't hear music? What the heck is going on? Better sound, no music. Still no music? No, nothing. All right, low. I don't know what to tell you. TikTok be wild in the day. Now we can hear the music? Or is it still low? Normal now. Cool. Unplug things and plug them back in. That is literally, I wonder if it has anything to do with the restriction. If they, when I got that notification, Griselda Alvarez, you are loud and clear. Thank you very much. I appreciate y'all giving me the feedback there. Uh-oh. It's summertime, so the basement gets a little warm, but that's okay because I've got my extended finger to turn on the fan. The music was super low. Yeah, I just unplugged. I even restarted everything. Phone, laptop, the sound system. I restarted everything. Do I think dialysis is a death sentence? No, I don't think so. I mean, it definitely complicates things. And for some people, it's a bridge to a transplant. Christy Wendy, my first PE was saddle Sats 96 on 100 on room air. So I remember from my days in the ICU, saddle PEs, if they as long as they didn't move, it was okay. Like when they would try to move, that's when things kind of got a little squirrely. Oh yeah, we dropped big time. That's okay. Thank you, TikTok. I was watching Justin's fishing live yesterday and he got flagged for unsafe behavior. Like dude's in a kayak fishing. And he wasn't even he was talking about fishing lures. Like he wasn't even talking about anything controversial. I get a little controversial. Your lowest was 86%. Yeah, we see that pretty regularly for various reasons, all kinds of reasons. Yeah, I popped on the moderation this app does is something. Yeah, it's weird. That's why I'm live streaming across other platforms. Speaking of which, let's take a look on the other ones. If I could get the same kind of audiences over there, I'd probably just go over there. But that's why I live stream on multiple platforms. Oh, look, do we have a couple? We have a couple comments. Jamie says, "Good morning from sunny Florida. Welcome in, Jamie." It's raining in Virginia, at least where I am. Oh, my appeal was approved. Hey, we reviewed and approved the appeal. Gifting and visibility for your live have been restored. I win. Suck it. I'll probably get flagged for that too. Oh man. I win. I win. Did you know you can send a bag of gummies to whoever you want anonymously? I'm just throwing it out there. You just got to go to your Google machine and type in bag of that's right. Bag of weenies. You can send a bag of weenies to anybody you want. You can do chocolate flavored, doesn't matter. And it's anonymous. I'm not saying I've done this. I'm just saying it can be done. Now, the real question will be like, what happens to the numbers in this live? Are they going to go back up to like 130 or are they going to stay here? And it doesn't matter because y'all are here now. And that's the most important part. Agu, what signs should I be aware of for a closed CT? For a closed CT, I fainted and hit my head. ER didn't brain scan. So I don't know. Assuming you are younger, I don't know how old you are, but there's like an algorithm they look at based like, are you on a blood thinner? Did you lose consciousness? So they kind of look at this algorithm and then they weigh the risk versus benefit. So if the risk is low for like any type of intracranial hemorrhage, they're not going to risk that radiation. Now, if you are older and on a blood thinner, that is a slam dunk head CT every time. But like when my oldest boy was maybe 2, not even 2, not even 2, like maybe 18 months, his cousins came over and left the stairway door open, and he was old enough that he could get it open. He left it open, and yeah, PCARN is what we use for peds, and that's what I was getting ready to talk about. He fell down the steps, and it's like 12 steps. And so here's an 18-month-old. My wife, I was at work in the ER. She calls. She's upset. And I go in there and sit down with our ER doc, who is also our OMD at the EMS agency that I run at. And so he was great. And he sat down. We went through PCARN. We actually looked through it. And PCARN has like at the end of it an asterisk. And it basically says if the parents insist, you can do a head CT. If they're super concerned about it, you can do it. It kind of like overrides everything else. And he did not meet that criteria. And so we decided to kind of wait and see. And he seemed fine. He was scared more than anything. But yes, the Megan Marshall, it's sunny and 80 all week in Illinois. Ugh, 80, too hot for me. Too hot for me. Legal Nurse Leeds is in the house. Good morning. Oh, it's time for I don't have nails. Yeah, way too hot. I know. Legal that's like right up Legal Nurse Leeds. That's right up her alley. 80, she likes that. Yes, I don't have nails or hair. Thank you. I actually gave a fresh shave this morning. Oh, it feels so good. I would die for some sunshine in 80, 90. It's coming. Don't worry. It's going to get there. One love. I've been fevered since January 24th. My platelets are dropping. Fever min 100 to 102 daily. Who should I see? It should start with your primary, and then I would imagine you get a referral to maybe either oncology or infectious disease. I don't know, but I mean, since January, that seems like a lot, and nothing seems to have happened. I would, yeah, I'd definitely follow up. There it is. AIM says ASAP, adult head injury, CT criteria. Yes, that's what I didn't know the acronym, but yes, there is a criteria that they look at. Infectious disease first. Yeah, that would probably be what our hospital would do. We would probably go to infectious disease, and they would review all the labs and then kind of formulate a plan after that. Lost consciousness, 24-year-old, fainting daily for weeks. Sounds like maybe POTS. But yeah, absolutely you gotta see a doctor. I'm just some rando ER nurse and not even like the best ER nurse, just an ER nurse. Oh, so Ames, I got a question for you. So I did a post on calculating manual drip rates. Sorry, I got sidetracked. Squirrel. And the comments in there, some of the comments are not unexpected, but it was kind of like disturbing. And it talked about when I challenged my students to do long division, which were, how to calculate a manual drip rate. And people were like, bro, nobody does that anymore. Bro, we have calculators. Bro, there are pumps. And I was just like, "Oh my god, I hope none of you are nurses." If that is your attitude, I didn't leave that comment because, I'd get roasted and I'm just like, "Whatever, it's not worth dealing with all that." But yes, I saw those comments, I was like, "God, I hope you're never my nurse," because that is a nurse that thinks that way is terrifying. If you rely solely on technology and that technology fails one day, you are an unsafe nurse if you can't do basic math. And, like, I'm like, "Hey, that's great. Good for you that you've never had to calculate a manual drip rate." I have had to do that. During COVID, we had no pumps in the ER. All the COVID units, which was most of the units upstairs were all COVID units, they had all of the pumps. So we were doing manual drip rates, and we didn't have dial-a-flows. I love a dial-a-flow. I get spoiled with those, and we didn't have those. We had to do everything we had to count them out, man. That's like basic math. What if the pump malfunction? And that is one of my preceptors when I was in nursing school. He was a Air Force veteran, he was a cardiac ICU nurse, and he was a great instructor and, great preceptor, and he's the one that told me that. He said, "Look, I want you to go hang this," and I told him I was gonna go program the pump. It's like, "I can do that, I know how to use these pumps." And he said, "No, no, no, no. We just, got a power surge, and it fried all the pumps. You're gonna have to do it manually. You gotta calculate it out, figure it out." So, now fortunately, it was still fresh in my mind because I was in nursing school, so it didn't take me too terribly long. Mr. Clean says, "I've been in, nursing over 10 years, have had to calculate a few times, but each time was crucial." Right, and that's what we had to do in the ER during COVID because we didn't have pumps. We might start with a few, and then they would disappear. They'd go real quick, and then we couldn't get any more. Let me rephrase that. We had the pumps, we didn't have the channels. We had the Alaris, and we had, like, the main pump, but the channels were all upstairs where you stacked out 4 on each side. Bless those ICU nurses during COVID. God bless all of you. Amber Diane, thank you for the heart me, I appreciate that. Pepper, I work with a Pepper. Is this only for a quotation about nursing or quotation about anything? Are you talking about questions? Uh, we're nursing focused here, but we also have respiratory therapists, physicians, pharmacists, and we get off topic. Half of us have ADHD, probably more than half. So we talk about whatever. Ask away. I will have an answer for everything. Whether it's a good answer, that's up for debate. Also, yes, we have calculators, but also have to know how to set it up. True. Like, even if you have a calculator, you still have to know how to count that drip in the chamber. What Ayla, what happens when someone walks in and says they want to end it? So we put them in if we have rooms that we call psych safe rooms, so they don't have any ligatures. So it's basically nothing in the room, nothing they can use to hurt themselves. If they don't have a room available, then we will put them in a room and remove everything off the walls and make that room safe for them. And then they're one to one, meaning there's going to have a what we call a sitter or a patient safety tech, patient safety advocate will be at the bedside or a nurse. A lot of times, smaller hospitals will have to have a nurse because they don't have access to the other resources. And we will see that patient, and then we will have a doctor from the ER talk to them, and then we will have a psychiatrist talk to them. That's what happens at the ERs that I've worked at. Good morning, user. Ames total volume times strip factor divided by time. Right. It's really not that complicated. Now, what I have done is created like a little laminated card with because we have one standard IV tubing set. I think it's 20 drips per ml. And so what I do is I just calculate it out like how many minutes like for various sizes. So if we have like 100 mLs, 500 mLs, 1,000 mLs, and then over however many minutes, like the most common ones. And that way it's kind of like a cheat sheet. I've already done the math. But yes, if I had to sit down and do the math, I could do it pretty quick. Brenda Nanny, I slid down the last 4 or 5 steps yesterday morning. My whole body is annoyed. Tylenol or something else. Tylenol. So I would say as long as you're like able to take I like ibuprofen, that's an NSAID. It's an anti-inflammatory as long as you don't have any reason that you couldn't take it, no allergies, no kidney problems, you're not on Eliquis, you're not on a blood thinner, then I would say that might do a little bit better, treating the inflammation. Um, but if you hit your head at all or lost consciousness, you should probably be seen by a physician. But yes, I've done that. When I like, right after I came home from my emergency appendectomy, when I was discharged the next morning, I was so sore and I missed a step and I fell down like 6 steps, all on my backside. And I that was like I was in so much pain, from the surgery and then also from my back and my butt, and I don't have anything in the back. I have no padding in the back, so it was like all bone. When can you stop referring 5 cases at once to internal medicine? Never. I will never stop. In fact, today it might be 10. Just kidding. You're on a baby aspirin. It's the cat's fault. It's usually the cat's fault, right? Cats are kind of assholes. Yeah. Oh, dude, I was so worried that I'd pop something. Oh, like internally. Michelle, 2 weeks ago, I fell down my back deck. Oh, I haven't done that yet. It's like when you get older, like when you get to be my age, things that you used to like we've got like a retaining wall from our patio that goes up to like the driveway. And I did a post on this like a few months ago, where I was coming up to it. And I was like, you know what? There's a time I would just jump off this. It's not that far. It's like 2.5 feet, not that big of a deal. But when you get to be my age, you're looking at that going, no, I do that and I'm blowing an ACL. We're not doing that. We're going to step down. Same thing going up. I used to just like launch myself up and like jump over top. And I'm like, no, at this age, I might miss that. And I'm going to take a header and I'm not doing that. Oh, Mr. Clean. So nice. Got to play it twice. I've always blamed the wife. Well, wife did it. Oh, don't you love it? Like when you come to the ER and you're trying to ask the safety questions, like, hey, do you feel safe at home? And he's like, no, my wife beats me. And you're like, bro. And the wife's like, don't tell him that. Like, come on, man. Like, I need you to be serious for a second here. Now, ideally, you're supposed to ask the wife to leave the room so he can give an honest answer. Have I heard of type 3 von Willebrands? Not type 3. I've heard of von Willebrands. It's a clotting factor disorder. I always say, legally, I have to put what you tell me. Patient feels unsafe at home. No, no, no. I was just kidding. Are you? Are you just kidding? This is not a laughing matter. The Megan Marshall, my husband says that all the time. Like, I'm 5'2". Uh, you do 100 pull-ups with a weighted vest. I'm not fucking with that. Like, when my dad passed, do you think his last moments were of me? I don't know. Maybe. I've heard reports of like life flashing before your eyes. So I'm sure there was definitely some of that going on. I don't know though. I like to think that. I would like to think in my last moments that, my family would I would think of my family and, like, all the happy times, especially with my kids. I love your lives are always when I cook, makes my morning more entertainment. Oh, good, I'm glad. That's why I love doing these. It just takes me back to the early '90s when I did radio, and people would listen while they were doing things with their morning. Mr. Clean used to ask the question about harming anyone. Uh, some would say, "No other than my spouse," jokingly. Right, yes. I get that a lot. Any thoughts of harming yourself? No. Any thoughts of harming anybody else? All the time. Oh, come on, man. Just, can we just not do the jokes when we talk about violence against people, please? Burning vertical ache on left abdomen. Any ideas? You should go see a doctor. Like, I don't say that flippantly. I mean, like, that could be anything. And I can't do anything about that from here. I'm an ER nurse. I can't even diagnose anybody when I'm at work. All I can do is assess the patient and have the doctor come see him. So if you're having new pain in your abdomen that is concerning to you, you should go get that checked out. You can go to an urgent care. It doesn't have to be an ER. You can go there first and see what they say. You'd likely be seen faster. Drone seeker, I'm 57-year-old male with hip arthritis, needs surgery replacement. How's recovery? I mean, it depends on a lot of things. Depends on how well the surgery goes. It depends on your comorbidities. So if they're doing the surgery, that means that obviously you're in a place that they feel comfortable doing the surgery, that they think that your recovery will be okay. And then how diligent are you going to be with your rehab? And trust me, they're going to get you up and moving pretty quick, a lot quicker than you think. But yes, it can be. But I work with a guy who's like a year older than me, and he's had both hips replaced, and he says he's like a new man, and hasn't had any complications. So for some people, it can be really good. I know other people do have complications, so can't speak in general. Only speak in generalities. Can't speak for everybody. Daniel, good morning. Welcome in. Hi. The Megan Marshall. I always get sad when they ask, knowing there's people that should say yes. And that's the other thing. When I ask the questions, any thoughts of like harming yourself? And they're like, "Oh my gosh, no. Like, how could anybody do that? That's so selfish." And I'm just like, "Whoa, whoa." And so I always take that moment to kind of educate people. And I was like, well, I don't think it's selfish. Having worked with a lot of psychiatric patients who have been through this moment, in their minds, they think that is the only option and that is the best thing for their family. So their families aren't burdened by their mental health anymore. And sometimes they kind of look at you like, oh, sorry. But yeah, I take that opportunity to educate people. 'Cause that's how my dad used to think, and then when I had my episode, like, I had to have a conversation with him, and I think it did connect with him, I think he understood it a little bit better, but his thing was always, "That's selfish. You're not thinking of other people." Of course you're not thinking of oth I mean, you are, actually. You're thinking of other people because you think that's gonna be best for them. You feel like you're a burden, and you wanna take that burden away from them, and you think that's the best way. I worked with a guy who, took his own life a couple years ago, and he was a young guy, like, in his mid to late 30s, and he had young kids, and I know the question is, like, how could you do that to your kids? In his mind, he probably thought that was the best thing for him. He thought that they would be better off. He convinced himself of that. I'm sure of it. Can citrus tea cause gut to be upset? Sure. Citrus is an acid, and that can cause stomach upset. Also depends on what other things you're ingesting. Pickle Rick, yeah, that gets me too. The mind gets sick just like yeah, mental health is physical health. It really is. That's why people that come in and panic attacks and anxiety attacks have chest pain. It manifests as physical symptoms. Asia, good morning. Welcome in. I'm epileptic and have this is Eliza. I'm epileptic and have insomnia. My doctor called in on Friday, a med to help me sleep so my seizures will stop. Well, that's good. I'm glad you called your doctor and explained your symptoms, and hopefully the medication they prescribe will help you. The Megan Marshall, also everyone says worry about yourself, so that's probably in grave too. Sure, yeah. Asia, I'm glad were able to stop by this morning. It's been a lively live. Uh, TikTok didn't like something I said. I appealed. I won, as I usually do. It's all AI. That's all it is. They're looking for certain keywords, and if it doesn't have any interpretive abilities. It just looks for something and then smacks you down. And then like they restrict your live, and then by the time you get it back, the damage is already done. Asia's exhausted, heading to work shortly, but I was off yesterday, so all is well. Oh, good. I'm tired. I haven't slept good the last couple of nights, like maybe 4 hours of sleep the last couple of nights. Just not sleeping good. So I'll probably have to take a nap today. What is the difference between CT and MRI? So I mean, MRIs use giant magnets. I feel like MRIs are way more detailed. They take a lot longer to do, but they're going to show you pretty much everything. My experience with CTs, they're kind of a quick and dirty way to, and for most things, they're good, right? You want to see a head bleed? Great. You want to see something going on with the intestine? Sure. Drink some contrast, wait an hour, 90 minutes, and we can see pretty much all the things we need to see. However, anything that involves joints, tendons, not joints, but like tendons, ligaments, like if you have maybe a torn ACL, any type of rotator cuff damage. MRIs are going to be better for that. For strokes, MRIs are going to be more definitive, and they're going to be able to actually tell you where the damage is compared to a CT. CTs can tell you some things, but mainly what we use CTs for is to rule out hemorrhagic stroke. So a patient comes in with stroke-like symptoms, we call a stroke alert. They're going to CT pretty quick. We want to make sure it's not hemorrhagic. So about 13% of strokes are hemorrhagic. That means there's a bleed in there. And we need to know that because one of the first medications we can give is TNK or tenecteplase. And it's like a clot busting drug. If they have a hemorrhagic stroke, we don't want to give that because that's really bad. And then the other 87% of strokes are what we call ischemic strokes. That's a blockage somewhere that's causing the symptoms. And that is what we want to give or consider giving a TNK or a tenecteplase with the consultation, obviously, of a neurologist. Now, we can do a CTA. Which will also give more information to the neurologist. MRIs take time, and typically, if we admit somebody, that's going to be done the next day. But they're going to show you everything. I've had an MRI of my brain, and it took a while, way longer than a CT. Just Josh, what's the craziest thing I've seen in the ER? I don't know. Lots of things. The the guy on I've talked about this before. The guy on street meds who self-enucleated bilaterally. You can look it up. Takes a special person to work in the ER. Thank you for what you do. Thank you, Deborah. I appreciate that recognition. Agu, they want me to have an MRI, but I have metal plates. What options are there? Metal plates would be challenging even for a CT because they're going to light it up like a Christmas tree. So, yes, if you have metal plates, the MRI is probably, I think there are some metal that they can do, but generally speaking, no. I'm not an MRI tech, so I don't know. Drone seeker, I retire in 7 months, getting hip replacement right after. Is cortisone injection okay to bridge the gap? I don't know. That would be a good question for your orthopedic surgeon. I don't know what they typically give post-op. Are you talking about like to bridge you until the surgery? Again, yeah, you got to talk to your orthopedic doctor. Michelle K, I do the same educate. My education lost my brother to that. Won't allow my comment to show. Sure. Yeah, because we're talking about, sensitive issues. Gary, have you won a Daisy Award? No. I'm an ER nurse, man. I've never even been nominated for a Daisy, and I think it's great. When people get them, I think that's wonderful. That's not my goal. Like, I don't go to work thinking like today I'm going to get nominated for a Daisy. I just go in and do my job. I try to be the best nurse I can. If I get one, great. If I get nominated, fine. But it's not on my bucket list. How do you get yeast out of the bladder? I would start with a urologist. In the bladder? In the bladder? I mean, there are medications they can give for that, but I'm not a urologist. I don't know about that specifically. The Megan Marshall had to take my daughter to a pediatric ER when she was little, and those people are, oh my gosh, yes. So our 10-year-old has had to have a couple of surgeries when he was little at UVA. And I just remember in awe watching, and I was a nurse at this time, in awe of how easily they made it, they were able to get an IV on him. Like I looked because I was curious, right? I was like, oh, I want to do this. Now I've done pediatric IVs, not very many. I've done a scalp on a baby and I've done like ACs with 24 gauges. But those were pretty obvious. Even for the little kids, I was like, oh, I can feel that. Like I feel confident. A lot of times I can't even feel it. I could not feel it on him, but that pediatric nurse came in there and she like put that little itty bitty tourniquet on there and we were distracted him and she tapped her little finger right there in his AC and she grabbed that thing and she popped it in there and I was like, "What? How did you do that?" It was like magic. It was amazing. I was like, "You're an absolute rock star." So if you're a pediatric RN and you are good at starting IVs on kids, teach me, wise one. How do you know if you're having a heart attack? You don't. The classic signs of heart attack that people think of, the clutching the chest and like the diaphoretic, and like I feel like an elephant sitting on my chest. That's a very small percentage of people who have those classic symptoms, especially with women. Women can have symptoms up to 2 weeks before the heart attack happens. Just feeling bad, don't feel right, maybe their stomach's upset. So if you're a woman and you're having weird symptoms, fatigue, I just don't feel right, something's off, you should go see a doctor because your symptoms are not necessarily the classic presentation, and we do not want to miss that. So anytime a female patient comes in and they're like, I just haven't felt right. Something's off. I'm like, whoa, okay, we're getting an EKG on this right now, and we're getting blood work because I, we don't want to miss that. Maybe she's just feeling bad, but that we don't want to mess around with that. Too many women have heart attacks that go undiagnosed early enough. But the classic chest pain is the thing that most people think of. Michelle says I could do an IV on anyone. Cool. I haven't had to do a pediatric IV in a long time. And I can do ultrasound now, so, like, I've got that tool in my toolbox. Let's see. I don't know why, but when I feel like I should go to the ER, I don't because I feel like I'm wasting resources. Are you a nurse? That sounds like something a nurse would do. They call me one shot wonder, even newborns. Oh, yeah, we had a nurse like that, and whenever we had a pediatric patient come in, especially, like, the little ones, we'd be like, "Yo, Michelle," and her name was Michelle too. Must be a Michelle thing. Angela, what's the environment in the ER like? What do we expect as nurses in the ER? The environment can be very chaotic and it can change in a heartbeat. So it can go from 0 to 100 very quickly, and you got to be able to adapt and move quickly and communicate well and work together as a team. I know it sounds cliche, but that really is how a good ER functions. The Megan Marshall, I'm always fatigued. Me too. Worst diabolical person. Oh, I've taken care of some inmates have done some pretty awful things. Ames, thanks for the daily for the finger hearts. Appreciate that. And Danny P, thank you for the daily heart me. I appreciate that as well. Mr. Clean, I used to joke about putting an IV in someone's forehead until I actually had to do it. No more joking. So my question is, my thing was, and I had to look it up. Oh, Danny P coming in with a go populars. Thank you. Is I never knew which direction to go when you get these like scalp veins. Like here, like this vein right here, like, do I go this way or I did go this way? So, and I think when I asked, I think the answer was it doesn't matter. At that point, it doesn't matter. I don't know. That's what I was told. Angela, would you recommend that or what unit would you recommend new grad? I think new grads should go to whatever unit they feel drawn to. I felt drawn to critical care, so I started in the ICU and then went to the ER. If that is not for you, then go somewhere else. But no, there's no specific unit you have to start on. And if there's somebody out there telling you should start on med surge or this unit or that unit, don't listen to them. Will you get valuable experience working on those units? Absolutely. Time management on a med surge unit is crucial, and you will learn how to do that very well. And you will learn how to multitask very quickly. But if you are ADHD, ER is a good place for us. If you are type A and you like things nice and neat and organized, ICU might be a good place for you, or step down or something like that. Alyssa, going for my BSN now. Any tips? I would say if you're in a BSN program, hopefully they have some type of NCLEX prep built into your program that you're doing incrementally. I think stick with that, and I think you'll be fine. Keep your eye on the prize, your nose to the grindstone, focus on your studies. Social life can come later. Holly, I know I missed a few people coming in because earlier we had such a big crowd. Matthew Nelson, when I show up for toe pain for 4 days by EMS, Yes, I appreciate the sarcasm. You're right. Okay, so I want to share a little information that I learned last night. And it was a good interaction. I did a post about this last night on the post shift debrief right here in the studio. Had my little hat on and everything. So we had a patient come in who was 5 days out from a total hip replacement and complaining of hip pain. Makes sense, right? EMS brought him in and we go to assess the patient and immediately was like, "Ooh, I don't think this is the hip." His bladder, like his lower abdomen was so distended. So we immediately did a bladder scan, over 1,300 mLs in his bladder. And I think that was the source of his discomfort. So the physician who I love working with, he's a younger guy, he's a little bit younger than me. He was a COVID ICU doctor during like the worst of it. And he took a break. He went to do long-term care, and then he came back to the ER a couple years ago, and so we're grateful to have him back. So he ordered, obviously, a Foley to drain, and then he said, "Make sure you clamp it at 400." And I had remembered reading about this not too long ago. I try to s I we use Up to Date, and I try to stay up to date, and they always post, like, changes in the login screen, and so I try to read those. And I remember had read something not too long ago, and it said that we don't do that anymore. We don't clamp. So what I did was I said to him, I said, "I don't think we do that anymore." And he goes, "Well, if you can show me the evidence, then sure. But until then, make sure you clamp it at 400." Now I was a charge nurse; it wasn't my patient. So while the nurse was setting up to do the Foley, I went and looked at Up to Date and looked up rapid bladder decompression. The evidence has changed. So if you're still clamping at 400 or whatever the prescribed is, we don't do that anymore. They don't recommend doing that. The evidence is not there to support it. And in fact, the evidence that is available shows that we can actually do more harm than good by doing intermittent clamping. So the recommendation is to let the bladder drain naturally to gravity. And this guy put out like 1,400 immediately. And guess what? He felt better. Now, is there still a risk of bladder spasms and other complications? Yes, but the research doesn't show that there's any increased risk by doing intermittent or letting it go. And in fact, there's actually worse outcomes if you do intermittent clamping. So if you still have doctors that are doing that, that is no longer best practice. And you can take that evidence to him, which I did, and I showed him, and he read it, and he just held up a hand and he like fist bumped me and he said, "Nice work, man. Thank you. Go ahead and unclamp it and let it run to gravity." So a doctor that is willing to listen to a nurse who brought them evidence-based practice and then change their practice was a huge victory for that patient, for me as a nurse, and for him as a doctor. And it was a wonderful exchange. And I even went to him afterwards and said, "Hey man, I really appreciate you listening to me and taking my concerns seriously." And he was like, "Absolutely, man." So good doctors will do that. Mr. Clean, we were taught to clamp at a liter. I think we were at 400 is what we clamped at. And yes, clamping can lead to people forgetting to unclamp, and now you've got bladder distension, and that's not good either. Why is that not recommended? So if you go to Up to Date, if you have Up to Date, if you go to Up to Date, it talks about there's like bladder spasms, there's increased risk of bladder spasms, and there's a whole host of other things that can potentially go wrong. I don't remember them all off the top of my head, but the evidence is out there. The truth is out there. All right, Jen, have a good day. Got to get these kids off to summer camp. Oh, my kids are in their last week of school. Summer camp starts Monday. They get a weekend off and then right into summer camp. So, yes. Do you think the nursing shortage, hospital? What do I think of the nursing shortage, hospital wide, has gotten any better since COVID ended? No, I don't think so. I don't know if there's really a nursing shortage. I've always heard that. I don't think that's necessarily the case. I think there are hospitals that intentionally leave open positions to create a nursing shortage because I have heard from many nurses, new grads, experienced nurses that are having a hard time finding work in certain places. Obviously, not everywhere, but yes, in certain places they are having trouble finding work. Why is that? If there's so many job openings, if there's such a nursing shortage, why are people having a hard time finding jobs? Yes, that's the thing about nursing. As Mr. Clean puts in his comment, things change. Evidence changes as research comes out. We ask questions, we challenge the norm, and then we find out that maybe the things that we've been doing aren't best practice. And so we change those things. Darian just pulled up to work and forgot my badge. Oh, dude, I've done that like twice. That is not a good day. That is not a good day at all. Pickle Rick says, yes, that's how I feel. Shortage is a myth. No shortage of nurses, only a shortage of those who will take BS from hospitals. Exactly. Yep. I'm with you on that. Sarah Savvy, they post openings to pretend that, right? Exactly. They have all these openings, and yet people are like, I applied for a job there and did not hear back. They're not hiring. But then why do they have 150 open positions? Susie Moo, good morning. Welcome in. Let's see. Hi, can I drink three multivitamins a day? Is it bad for my kidneys? Drink multivitamins? Uh, if you're taking multivitamins, you should consult your doctor first, because not all multivitamins are good, and not everybody needs to take them. In fact, typically most people don't. There's no evidence to support that multivitamins help. There's a very select group of patients, usually very elderly, where multivitamins can play a significant role. But generally speaking, there's not a lot of evidence to support that that has any good outcomes. It's improves your health at all. Now, some people who are chronically low in certain, whether it's magnesium or potassium or whatever, like there's a case for those replacements. But in terms of multivitamin, there is not a lot of evidence to support that. And that's been studied a lot. Do you know much about infant lump by nipple? No, I'm not a pediatric ER nurse. That is a good question for a pediatrician. Eat your vitamins. Yeah, a healthy diet. I think, though, that can be challenging as people have more food insecurity than they used to. Having access to quality nutritional food is harder for a lot of people. I am very fortunate that it is not for us, so that's good, but not everybody is in a fortunate position as I am. Ah. Yes, beef is very expensive. Pickle Rick, what is your clinical pet peeve, as in practice, that you think needed to go a long time ago? Orthostatic vital signs. It doesn't tell you shit. I hate those things so much. And there's not a lot of evidence to support its continued use, but we still do it. That drives me absolutely batshit crazy. If they even mention the word dizzy, they're like orthostatic vital signs. Okay. What, what is that going to change about your treatment plan? And they can never answer that question. It's just to check a box. We checked orthostatic vital signs, and we've got some dumb metric that we've got to, if they actually review the chart. If at any point during that triage or the doctor's assessment, they mention dizziness and we don't do orthostatics, we get dinged on that. And I think that is absurd. Show me the evidence, because I can't find it. Thank you, Angela. I try to stay real. Like, I keep it 100. I try to anyway. How do you unlearn being anxious during clinicals? I'm struggling with it. I think I'll never be good. I don't think I think all nursing students or anybody going through, like, whether it's in medical school or nursing school, I think everybody has some baseline anxiety, that fear of failure. There's a lot at stake. You're paying a lot of money to get this education. The the risks are there, like if you don't do well. So yes, I think anxiety affects everybody to some degree. Now, some it is worse than others. Um, if you don't already, I would maybe explore getting a counselor or a therapist and talk to them and work through that. Ames, thank you very much for the Go Populars. I appreciate you. Mama Wop says it'll go away about a year into your career. Yeah. I don't know. There's sometimes I still get anxious. What level ER do you work in? Right now, I just work at it's a VA hospital. We have an emergency room. We're not a trauma center. We're working on it. Apparently we're going for a level 3, which would be awesome. That means they'll pay for me to get my TNCC again. You are welcome. Hang in there. Nursing school's a challenge. So once you get through it, though, And Pickle Rick says, find a good mentor as well. I've had some really good ones help me conquer mine. I worked with a couple of my clinical students who were highly anxious. I mean, highly anxious. And, I did my best to kind of like walk them back off that ledge. So, J Dog, I'm a paramedic. How often does the stories change from handover? A lot. That patient that we had that had the distended bladder, that was not even something that came up during report. This was all left hip pain. And you're like, when they get here, it's like, bro, did you even look at his stomach? I mean, he's like having a baby. Like, I seriously, in my career, I've never seen a bladder that distended. And he was not a big guy. He was a little guy. And it literally looked like he had a volleyball like protruding from his lower abdomen. And I was like, that's not normal, right? You know that. And it was a paramedic. I mean, they got an IV and, yeah, so and then what else did he say? He said something else, like, the nurse said, "Hey, did they say anything to you and report about this?" And I was like, "No." I was like, "Yeah, he's got this too." I'm like, "Whoa, need to refocus on the assessments here." Sometimes I think we get slack and I still run EMS. Sometimes I think we get hyper focused on whatever, "Oh, this patient had a hip replacement. So that's what's going on. It's this pain has got to be related to that." And we forget to do the full assessment sometimes. Agu, what are the types of trauma levels? So there are three designations. There's level 3, level 2, and level 1. Level 1 is the highest. So a level 1 trauma center can take any patient, with the exception of a burn patient. They might be able to take it, but that's going to have to go to a like a burn hospital with a specialty. They have to have a burn designation, a burn center designation. So, level 1 trauma centers can take anything. They've got all the specialties. They've got cardiothoracic surgery, vascular surgery, neurotrauma surgery. They can take anything. Level 2 trauma can take most things, and there are criteria to be met for that. But they can't take everything. And then level 3 can take anything and stabilize them, but will most likely have to ship that patient out to a higher level of care. I've worked at a level 3 and a level 1. So level 3 is you get a really bad multi-system trauma roll in, multiple GSWs. You can manage all of that, stabilize that patient, and then transfer them to a higher level of care. Like Ames says, trauma is fun, but medical mysteries are cool too because it's like putting a puzzle together. You get all these values back. You've got the like your physical assessment, the history, your lab values, your imaging results, and you're trying to kind of put this puzzle together. And sometimes it is challenging. You're like, man, I don't know. Like the labs are stone cold normal. Like clearly something's not right here. Lex Wex works at a level 1 trauma and love it. I get to see so much. I do miss working level 1 trauma. Um, my mental health does not. My mental health is much better. I was level 1 trauma during COVID, and that really took a toll on me. I didn't realize how much it did, but it did. But I do miss it. I do miss it. Matthew says trauma is my expertise, but I love a good cardiac patient. I like heart patients too. ACS and heart alerts. I like doing that. Stroke alerts are I kind of like doing stroke alerts too. Like I'm really hyper focused on meeting the metrics. Like as soon as we call it, like I'm as a charge nurse, I am putting in the order set. I am calling teleneurology. We use National Telestroke Program at TSP, and I love doing that. Like I'm like, yes, let's get all these metrics. Let's get this patient back there, give them the best chance they have at a full recovery. I absolutely love doing that. That's where the type A personality comes into play. I used to be an ICU nurse, so that's where that comes in. I like checking those boxes and hitting all the metrics because that means if we're hitting our metrics, that means we are doing the absolute best we can for that patient. Jane says, I will be a nurse one day. Excellent. What country are you in ERNS? I am in the United States. I were Matthew Nelson. I worked at a regional stroke facility, got burnt out on strokes, but learned a lot. I could see if I did it, if that's all I did, yeah, I could see getting burned out on that. If I could be a full time charge, I would do full time charge. Ah, you're a paramedic in New Zealand. Ah, very cool. A lot of nurses have tried to sell me on becoming a nurse in New Zealand. I would. I've got I've got family though. Can't move them all the way out there. As much as I would love it, I don't know if my family would love it. Ah, I'm telling you, this little thing is awesome. These coffee mug heaters. So you can have like the thing that I would always have to put in a thermos because if I brought this down here, it would get cold. But now I've got that little ceramic heater. You set it on top and it keeps it warm and hot. Have you ever whelped before? I don't know what that is. Ramping every day for Amos. I don't know what that means. What does ramping mean? Lisa Magical. I worked high level neuro ICU, burned out quick. I bet. I I could not go back to the ICU. I think I would be bored. As someone who wants to get into nursing, what made you pick being an ER nurse compared to others? Um, I worked EMS prior, so I had some familiarity with emergency, like medicine to some degree, or emergency care. An ember mug. What's an ember mug? Ooh, do tell. Sorry, squirrel. Um, so when it came time to change careers to go into nursing, it made sense to me. Like I felt more comfortable in a critical care environment. I wanted to start in the ER, but there was not a position available, so they offered me ICU, and I said, "Oh, this would be a good opportunity." I did like my ICU practicum. So my last part of nursing school was in an ICU. And by the time I was done with that practicum, I was managing 2 patients by myself, with obviously under the watchful eye of a very good ICU nurse who was still at the hospital that I'm at. And so anyway, but then I did that for a year, and then I ran a code with an ER nurse, and she was like, "Hey, have you ever thought about becoming an ER nurse?" And I said, "Yes, I have." And she goes, "We've got an open. You should come join us." And so I did, and I've been in the ER ever since. Was it easier to be a nurse or an EMS? For me, being an EMT was easier. It was 3 months of school, EMT basic, and you're good to go. Nursing school was 2 years, 2.5 years for me, and a grind and stressful. Let's see, electronic mug. Set the temp with an app on your phone. What? What? Okay, I'll have to look into that. Whelping is birthing puppies. Oh, interesting. I didn't know that. May have heard that in the past. Kavi saw level one trauma ER. It was insane. Yes, level one trauma centers can be wild. I loved it though. Absolutely loved it. Fun fact: I invented those coffee heater coasters in the gifted program years ago. Oh, very cool. Yeah, let's see if I can show you. I turned it off now because I'm done with my coffee. Ooh, it's still hot. See? And there's three temperature settings. So it's cooling down right now. Ramping means being parked outside the hospital as they won't let you in because they're too busy. Oh, yes. I don't know what we call it here, but they would just line up in the hallway during COVID. There would just be like stretcher after stretcher, just waiting for a bed, but we didn't have any. What type of unit of nurse would you not want to be? Anything pediatrics, sick kids. I have a lot of emotional damage from sick kids. So I don't think I could do that. Not full. I've taken care of sick kids, but not as a full time job. I couldn't do it. I couldn't go into work every day and do kids. How do I tell the difference between I, Ames? I just got your text. She's sending me links to the coffee mugs. How do I tell the difference between heart attack and panic attack? You can't. You can't tell the difference until you test for them. So if you are having chest pain, you go to the emergency department and we will rule out anything heart related. And if we make sure that you're medically safe, then we will look at other causes. Sharon says, "Yeah, I agree. I couldn't do sick kids either." No, I've always said, I have the technical ability to do it. From in terms of medicating, assessing, treating, doing all that stuff, I can I can do all that. It's the emotional toll that it takes on me as a parent. I am not strong enough to do that emotionally. And I have so much respect for and gratitude towards the pediatric nurses that can. What do you think is the easiest nursing? I think that depends. Gypsy RN, thank you very much for the daily heart me. I'm not a psych nurse either. I couldn't do that. That is not my wheelhouse. There are nurses that are really good at it, and I'm grateful for them as well. I don't know if there is something that I would say is easy nursing. It depends. I think being an ER nurse for me is easy. Like it comes naturally to me. I think going to work in dialysis would be really hard for me. But for dialysis nurse, that's pretty easy. That's what they do every day. All right. Let me check up here. I did not do a good job of keeping track of the other comments. I think we even did Twitch today. I don't know. Let me check to see. Did we do that on Twitch? Yeah. No, I don't know if we did or not. Can't tell. I'm not really good at Twitch. Somebody said you should go on Twitch. I'm like, there's nobody on Twitch that's going to watch me. But I guess you don't know until you try, right? Orthopedics is easy. Okay. No, not for me. Not for me. Let's see. 8,900 likes. Get a few more taps on the screen. Maybe we'll get to 10,000. I don't know. But it's about time for me to get off here because I am solo parenting this morning. Wife's at work, so I got to get the kids off to school. Does it really matter where you go to nursing school when they hire you? Not really. Now, if you have bigger aspirations to maybe do CNRA school, maybe they take that into account. But generally speaking, you know, it doesn't matter as long as you pass your NCLEX, they don't really care where you went to school. I mean, maybe if it came down to you and another candidate and everything was equal and one person went to like the top nursing school in the country, maybe they would hire that person. I don't know. Let's see. Did I miss your question? Some questions get like hidden and I can't see them. Let's see. What are the types of specialties? Oh, there's all kinds of specialties. There's emergency, there's ICUs, there's specific ICUs, there's neurotrauma ICU, cardiac ICU, medical surgical ICU. Um, Probably even have pulmonary ICU. You've got medical surgical units, you've got step down units, you've got dialysis. You even have like neurotrauma med surge. So it depends on the hospital. The bigger the hospital, the more specialties they're going to have. Queen Nads AU, thank you very much for the follow. Appreciate that. All right. I think it's time for me to jump off here and go get my kids ready for school. Appreciate y'all stopping in this morning. Had a pretty good live. TikTok tried to get in the way of that, but we win yet again. We will do this again tomorrow morning at 6:30. Maybe we'll get a bonus live in this afternoon. So stay tuned to keep an eye out for it. As always, be kind to others, be kind to yourself, prioritize your mental health. I'm Gary, the ER nurse. We will see you tomorrow morning. Have a great day. And for those of you on the other platforms, Instagram, Substack, Facebook, Twitch, and everywhere else, thank you all for stopping in this morning. I hope you all have a wonderful day. We do this every weekday morning, 6:30, and we will see you here. Y'all have a great day.